Today I'm going to be talking about what is pelvic floor physical therapy, what to expect at your first visit, and what you can expect at your upcoming treatments. So if your medical provider recommended pelvic floor physical therapy, you've heard about it from a friend or somewhere online, but you have no idea what it is or what to expect, this video is for you. I'm Dr. Alex Hill, your physical therapist for everything oncology and pelvic health. Let's get into it. First, let's start with what is the pelvic floor? Well, everybody has one regardless of your gender, which means that anyone can experience issues with their pelvic floor muscles. The pelvic floor muscles sit at the bottom of the pelvis and they have 5 main functions. Sphincteric to control your bowels and your bladder, sexual, supportive for all the pelvic organs that sit in here. They help to stabilize the pelvic girdle, and they act like a sump pump to help with circulation in the pelvic area. There are 3 layers, an outer, middle, and a deeper layer, and your symptoms can depend on which muscles and tissues aren't working right or are damaged. So now that we know the basics about the pelvic floor, let's talk about the role of pelvic health physical therapists. Pelvic health physical therapists have the traditional training of other physical therapists, but with additional specialized training to assess and treat issues in the abdomen and the pelvic region. Yes, this does include both external and internal examination and treatment, meaning your condition may need vaginal or rectal examination and treatment. I promise it's not that bad. At your first visit, your physical therapist will go through your past medical history, surgical history, your medications, and ask a whole lot of questions about your current condition and symptoms. They may ask questions like how often you go pee, describe your bowel movements, or discuss the type of pain that you're having. I promise you, nothing that you say in pelvic health PT is TMI. The more that you tell us, the more we can help you. Now, most initial visits involve a physical examination, like I mentioned before, but if you don't feel comfortable doing a pelvic exam or treatment, let your therapist know. There are lots of other ways that we can assess and treat pelvic conditions besides doing internal work. The pelvic exam does not involve stirrups or a speculum, just a single gloved finger with lubricant. Your therapist will assess the tissue health, the reflexes, the muscle tone, sensation, and your ability to contract and relax the pelvic floor muscles. This information will help your physical therapist determine what's really going on and help with planning your treatment. Besides a pelvic exam, your therapist will also perform a general musculoskeletal exam. This may include assessing your strength, your range of motion, flexibility, balance, how you walk or run, and your posture. Again, all of this information helps us plan for the types of interventions that would most benefit you. After the examination, your therapist should discuss their findings and also recommendations for treatment. Often people have visits once or twice a week or maybe even every other week, but it really just depends on your situation. Your therapist will talk with you about that. Follow-up visits may include interventions like stretches, strengthening, pelvic floor exercises, hands-on manual therapy, both external and internal, use of electrical stimulation, and no, this doesn't hurt, and lots of education. Questions you should ask your pelvic health physical therapist before starting include what type of training they have specifically in pelvic health. Do they assess and treat both externally and internally? Because not all therapists who say they're pelvic floor therapists perform internal work. Do they have training to treat your gender? So this includes male, female, transgender, non-binary, or however else you identify. And finally, payment, including asking if they take insurance or if they're cash-based or out-of-network. Hopefully this video takes some of the mystery and fear out of going to your first pelvic health physical therapy appointment. Good luck, and make sure that you subscribe to my channel and turn on those notifications so you don't miss anything else pelvic health-wise.